Observers of this presentation will be able to learn about usability, configurability, and interoperability. Learn about team characteristics. Learn about the principal meaning and implementation of it. Find out about physicians and other key professionals' resistance to change. Learn about two of the presenters' companies, its strengths and flaws. Find out about the implementation phase's potential pitfalls and methods for avoiding them. Learn presenters' familiarity with automation and emerging information technologies. Usability, configurability, and interoperability, implications on new system cost, alternative system suggestion. Usability is crucial for the acceptance and safe use of health information technology solutions. The author argues that informaticians are guided by usability considerations while developing and acquiring technologies that people like using. Evaluation of usability may take place at several points during the product development process. For health IT to fulfill its potential in enhancing medical treatment and public health, it must be easily used. Health information technology relies heavily on human factors and human-centered design to ensure it is well-designed and compatible with clinician and patient processes. The usability of HIT systems may be a barrier preventing their wider adoption. Several HIT aid physicians in delivering effective, high-quality treatment. However, although HIT may have the ability to deliver certain advantages, it also has the potential to disrupt productivity, result in delays, and lead to mistakes. It is crucial to pay close attention to HIT usability in order to guarantee the most effective use of health IT, which includes factors such as the intended users, such as doctors, nurses, or pharmacists, tasks, and environments. Health IT issues raise questions about whether or not the system was intended to be usable by practitioners. Medical experts agree on the need of implementing HIT and its benefits to patients. Each company has its own unique set of requirements, procedures, and workflow. The interruption to productivity and needed modifications provide considerable obstacles for users. For this reason, configurability must let each solution be adapted to the particular requirements of each business and guarantee that each system was designed according to the highest standards. Due to the dynamic nature of healthcare, it is essential that this dynamic be taken into account while setting up HIT components. Taking a holistic, instead of technology-centric, approach will enable the setup of each system in a manner that provides for flexibility and adaptability at every stage of the process. Interoperability refers to health info technology that allows the secure exchange of healthcare data, permits full access, transfer, and use of all digitally obtainable health information for a permitted use, and does not result in data restriction. Accessing and securely sharing information pertaining to one's health has always been a difficult task. Incomplete awareness of an individual's or population's health requirements may lead to inferior results and greater expenses. When healthcare systems can share data easily, everyone benefits. Health plans might get a deeper comprehension of their use rates and service demand with more tightly connected health information systems. The value of these ideas should exceed the expense of implementing them. The advantages are more significant than the implementation costs. It's possible that the savings made possible by HIT solutions would more than offset the initial investment made in the technology by hospitals in order to improve patient data management. Interoperability reduces the time required for productive talks between providers and between physicians and patients. The more efficiently a team works together, the less time and money is wasted on administrative tasks. I was lucky enough to have a sneak peek at the Epic computer system and immediately fell in love with it. However, I haven't had the opportunity to work with it and so cannot provide a recommendation. For this reason, I must stick with the Cerner HIT system I am using at the moment. Cerner is a serviceable software package. After some time spent learning the system, navigating it, and using it, finding the features one needs is a breeze, allowing one to devote more time to the activities at hand and less to the computer. Still, I find the constant need to reload to be a major drawback. Anytime new information becomes available, the user of the system must manually refresh each screen. Besides that, it's a rather straightforward system that's practical, adaptable, and compatible with other solutions. Team characteristics. On the basis of an evaluation of the new system's needs and functionality, the required degree of knowledge and competence is evaluated for each application. Some of the team's resources are the end users, doctors, nurses, pharmacists, and IT. Consultants with extensive experience and knowledge are brought in to assist less skilled team members in the company with the development and implementation of the system. As part of their services, consultants will also develop custom features and programs for the system. In comparison to waiting for workers to undergo training and acquire the necessary abilities, this method may speed up the progress of a project. SIPE's principal meaning and implementation of it. Staff members will be less resistant to change if it is guided by a set of rules and standards that provides both structure and consistency during the transition. Because most individuals thrive on routine and predictability in their job and everyday lives, any form of shift may be a shock. So, it's natural and anticipated that there would be some pushback if anything novel is added. To apply the modifications and the concept, adequate training for all teams involved in HIT utilization, including their individual members, must be provided and implemented. By creating a medium for the exchange of ideas and constructive criticism, technology has the potential to alter the prevailing atmosphere in healthcare and educational settings. The worker's ability to favorably embrace upcoming changes is directly linked to the company's culture. If the organization lacks the culture, there will be greater opposition, and the adoption process will be lengthier and more expensive. For this reason, cutting-edge tools and methods need to be compatible with prevalent cultural norms to be widely adopted. Physicians and other key professionals' resistance to change. We must expect change. It is an integral component of our daily lives. Everything from one's relationship with others to one's surroundings and culture. Everything we know and do is undergoing a change in today's rapid-fire environment. But Tacherji and Hikmet argue that, much like biological systems, social systems seek to preserve homeostasis by opposing alteration and turning back to the initial condition. The authors argue that the hostility to hits is not so much directed at any one hit in particular as it is at the disruption of the status quo that hits generate. To start, poor levels of satisfaction among physicians and other critical professionals might result from improper configuration of a hit system. Potential drawbacks include inadequate usability, lengthy data input, disruption of direct patient care, less stimulating and rewarding tasks, ineffective health information interchange, and deterioration of clinical documentation. In most instances, the HIT system's technological limitations would prevent any of them from occurring. It might be because the program has to be adjusted specifically for the user's requirements in order for it to work properly. The most challenging part of the job has always been and will continue to be, figuring out precisely what it is that users want it to perform. The implementation phase: potential pitfalls and methods for avoiding them. There are a lot of benefits that informatics may provide to nurses. Informatics systems make it simpler to keep detailed records of each patient's health status, retrieve such information when required, distribute them across different divisions, etc. The extensive implementation of HIT is associated with a multitude of possible advantages to the healthcare industry. Contrarily, issues with HIT may impede care delivery and boost the probability of fresh, unexpected mistakes that can compromise the quality and safety of the clinical treatment and even cause injury to patients. Potential drawbacks include issues like HIT not fitting well with nurses' processes. It's not always up to PAR with their requirements, which is why they turn to other means. Additionally, technical difficulties are a possibility. Information systems don't always work well with other kinds of digital databases and files. The potential for zero backing from hospital management is still another potential issue. Difficulties will arise, that much is certain. What is essential, however, is the commitment, effort, funding, and support to overcome any hurdle, leading to greater overall happiness and adoption of any new system. Personal familiarity with automation and emerging information technologies. The Cerner HIT system is what I'm utilizing, as mentioned in one of the prior slides. This system's learning curve is severe and requires more time than I would want. It was unpleasant at first, but the longer I committed myself to the process, the more positive the results became. Incorporating the Cerner HIT into my practice has improved the precision of my assessments and the security of my patients' treatment. It makes me feel like I'm making a difference in the patient's situation and decreases the likelihood of mistakes being made in the clinic. In addition, the implementation of HIT has reduced medication mistakes, enhanced therapeutic management, and may provide a method for reporting medical errors. Now that I know what I need to know, I can rest easy and feel confident. Keeping patients' treatment consistent from one visit to the next is a fundamental role for every healthcare provider. Continuity of care may be achieved by the correct installation and administration of the Cerner HIT. For instance, this can be accomplished by giving clinicians prompt access to the findings of lab and diagnostic tests as well as graphs displaying the data. HIT's primary value is in its ability to lessen the reliance on paper while also easing the workload of administrative personnel and lowering paper usage. In the healthcare industry as a whole, nurses might benefit from the use of any kind of HIT in terms of facilitating uptake, removing hurdles to implementation, and creating effective strategies. Thank you.